So the shoulder is a really interesting structure. It's the most movable joint in the body. There are really two main reasons why. You have rotator cuff tendons and muscles, which allow you to bring your arm overhead, put your arm behind your back, allow for dynamic movement. You also have the shoulder joint, also known as a glenohumeral joint. I like to think of it as like a golf ball on a tee, so it allows for free movement of the shoulder. Sometimes these structures can get injured with overuse. An example would be, someone that's lifting weights in the gym, they're lifting weights overhead, they're constantly pinching those rotator cuff muscles in their shoulder. Or, people can just develop arthritis in their shoulder joint over time. So we have a lot of different treatment options for the shoulder. We usually start with physical therapy, medications, diagnostic imaging. Sometimes we do perform injections for the shoulder. There are two different ways you can do injections for the shoulder. You can do it under ultrasound guidance or through x-ray guidance. Typically what we do is we numb up the skin and the soft tissues in the shoulder with some local anesthetic, numbing medication like you get at the dentist. And then you introduce a little bit of steroid adjacent to the tendons or the joint. This can help in the short term to help reduce inflammation and help with pain symptoms, but they typically only last for about 3 to 6 months at a time, and then the pain gradually returns. The last type of injection that we can do for the shoulder, whether in a tendon or a joint, is a regenerative injection called platelet-rich plasma, or PRP. This is when we take the patient's own blood and we spin it down in a high-speed centrifuge machine, and that divides the red blood cells from the platelets and growth factors found in the plasma. And we take that injectate and inject it into the tendon or joint to help modulate inflammatory factors and encourage healing. This is extremely effective in treating pain as well as helping some structures heal, and it's very safe because it's the patient's own blood.